Hello, and welcome back to episode 41 of the Ben and Melanie Show. I'm your host, Ben.
And I'm your co-host, Melanie.
Yeah, we're both here today again. We took a week off mainly because I was sick, but obviously if you've been listening to this for a while, there's no regular rhythm or reason. We just won't record an episode for a while and then come back. But anyway, there's a lot to talk about in the news, I feel like. And I don't even know if I really want to get into it. But first, I just want to say this disclaimer at the very beginning. I do not condone, and neither of us, no one on this podcast, condones any kind of
Vigilante
targeting
justice.
or shooting of anybody, you know. That being said, that disclaimer's out of the way. I just really wanted to say that.
Yep.
Yep. I don't condone murder. I don't think murder is
Neither
a
of
good
us.
thing.
Yeah, it
I don't think
doesn't help.
violence is the answer. So,
Nope.
all right. Now that that's said, now we can talk about Luigi Mangione here a little bit. He's the guy that they caught after a 5-day manhunt, approximately after the killing of this United Healthcare CEO. They did catch him. Apparently, it would seem to me, from what I understand, he wanted to be caught. That he was found in a McDonald's with his weapon still on him.
Yep.
5 days later, apparently wearing the same clothes, which is bizarre and batshit. So that seems to me like he wanted to be caught. I know, I think that all discussion of this has moved very much to the backwoods of the internet at this point, the back end of Reddit. I do think that I know we're a little late to this party, but I think that it's good. I just want to say that I'm not surprised that this happened. I noticed in Michael Moore's statement he had a lot to say, obviously, and he said he was not surprised, though, essentially, whatsoever, that this has happened, and that more or less that it's surprising that it didn't happen 20 years ago, really. But he mentioned Michael Moore just very, very briefly in his quote unquote manifesto. I read his manifesto. It's not a manifesto at all. He just left some notes, really, for apparently the federal government investigators who caught him, and that's all it really was. And he just said, it had to be done, basically. But it wasn't any kind of manifesto or anything like that. I mean, I don't think that he thinks he's starting a revolution or anything. But
Did you read anything on his backstory?
He's rich. That's all I know. He's from a rich family in Maryland, which I think that makes it all the more poignant. I think that's why he's becoming this folk hero online.
Yeah.
And that, like I said, the back end of the internet more, deep down in Reddit threads and stuff like that, and places like that. Maybe I'm sure in the next issue of Mother Jones and stuff, he'll talk about a lot about it. And this is not mainstream at this point. I think the mainstream is trying to tamp it down now. They're trying to move on, trying to just not talk about it as much as possible. But he essentially has, I think, we kind of become a folk hero to a lot. And I think
so
it's
too.
Because of his wealth, or apparently born into somewhat prosperous family and millionaires, that they still had to deal with a broken ass system that didn't give a fuck who he was, right? So I think that's why that makes him a little bit more of a folk hero. I think if this would have happened, unfortunately, I think if he would have been killed by a poor person, the United Healthcare CEO there, this situation would be far different.
Yeah, it wouldn't have the impact. It wouldn't have had the impact that it does now. I mean, lots of people told their stories on Michael Moore's movie back in the day, and it didn't really change anything.
No, everybody sees it as the others, somebody else's problem. They're poor people. They're not me. I have my shit together until they have cancer or until they have some medical diagnosis which is not easily cured. Anyway, that's, man, I'm really kind of curious where the trial's going to go from here. He has also retained a very, very high powered lawyer. Can't think of her name. I could look it up really quick.
I feel like they're going to make an example out of him because I think that all of the CEO class, the upper echelon people, are afraid now, and I think they're going to put the screws to him pretty hard.
I think they're going to try. I really don't think it's going to work. I think actually he is. Oh, okay. Karen Friedman, and Angie Philo. Angie Philo? Okay. Anyway, she's like super big time Manhattan, worked for the Manhattan DA. Like, she's freaking awesome, basically. And I think that, like, that maybe has to do with this family's money. I really kind of. I know there's like a GoFundMe's out there to give him money. I kind of feel like those are probably scams. I don't think that that's a good idea to try to give him money through a GoFundMe at this point, even though, like, I know a lot of people would want to. I feel like that's not something that's a good idea. I'm sure that everybody's claiming to be him, and
Yeah, and I just read that GoFundMe has taken him down, and
yeah.
Luigi himself said that if any money comes to me from those things, that will be donated to other U.S. People that need
need help.
Yeah.
Yep. Anyway, I'm empathetic, obviously, with him. I'm sorry for the healthcare CEO's family, although obviously they're financially fine. But I'm sorry that they had to like have that disruption in their lives. But it's almost surprising this sort of thing doesn't happen all the time, you know. But
I think the big fear is that this is going to happen more often.
I think that is the big. I think that's why the media at this point is really trying hard to like. I think they're realizing really quick, like, whoa, this could get really out of hand really quick. So, and the funny thing is, I think the result of this shooting was really CEOs around everywhere now are just focused on their security. They're not actually focused on changing their policies or becoming, more compassionate toward their customers.
No, it's how much more security.
Just how much more security can they get. Mm-hmm. Yeah. I want to read this letter that made the rounds on Reddit, and it hasn't exactly disappeared, but it feels as if it's disappeared. I found it the other day. I found it in an anti-work subreddit, which then stole it. Apparently, they said from the nurses subreddit, so it came from a nurse or somebody through. It's a denial letter. I believe from United, it's a United Healthcare denial letter. And then it suddenly got posted to our picks, which is one of the mainstream subreddits, which then it suddenly got like thousands, like more than I've ever seen, like 70 some thousand upvotes and 7,000 comments. Like, that's insane. But I think that, like, if you live in the United States, you're quite familiar with these types of things.
Everyone has a story.
Everybody has a story. Yeah. I just want to read this really quick though, how this one actually came out. Dates to be determined, not medically necessary. Okay. This is a denial letter that somebody got, right? The clinical reason for our determination is you were now again. I'm just prefacing by saying this came from Reddit. This is not verified through some fact check. This could be fake. I mean, I'm not going to say it like it doesn't appear to be fake. It appears to be legitimate. And even if this is fake, there are tens of thousands of these letters written all the time that are very similar to this. Mm-hmm. But this one actually is kind of sad in a particular way. You were admitted to the hospital on 11/29/2024. The reason is blood clot to lung. We read the medical records given to us. We read the guidelines for a hospital stay. This stay does not meet the guidelines. You did not have to be admitted as an inpatient in the hospital for this care. This seems like it was written by like a 7-year-old. Or maybe, but I think that it's quite clear. Yeah, it was not written by, it could have been written by a child. Maybe that would have been better. But like if a child got to make this determination, it was obviously written by AI.
Yeah.
I think that's what everybody, it was quite clearly written by a computer program. Not even AI, maybe just a computer program, essentially. Anyway, or a program made the determination anyway. You had tests that did not show... Oh, sorry. The reason is you were watched closely in the hospital. You were stable. You had tests that did not show any problems that needed inpatient-only treatment. The records showed your blood pressure was not too low. You did not need a breathing machine. You could have gotten the care you needed without being admitted inpatient at the hospital. the hospital inpatient admission is not covered. We let the hospital know that it is not covered. Like, oh my God. And this was apparently for a blood clot, to the lung, which is another word for a pulmonary embolism. So, like, this person could have died.
Yeah.
The doctor made the right call, obviously, by having them stay. But you know what? Because they didn't die, that's not covered. So at that point, I kind of think that maybe the only way that would have been covered is if they did die. So they didn't actually just die. That's actually how that is the most fucked up shit. Like, our system essentially is run by computer programs now that are making a determination, not by death panels, not by the scary death panels that everybody was warning us about in 2012 or whatever. Nope, it's just computer programs that are just making the determination. It's like, you did not die at your scheduled death time. Like, this is actually terrifying, actually. I don't know. But
I agree. I think it's terrifying. When I read that letter, I was just like, the wording sounds a lot like letters I've gotten from our insurance company, which is not United Healthcare, for just medication. Sorry, you got started on this medication. We're going to cancel it now. Your doctor is trying to get a different dosage, so forget about it. Your maintenance dose.
Yeah, actually, they kind of do that. Like, we are not unfamiliar with the medical system. Both of us have lots of medical problems.
Yep.
And this is not an unusual type of situation to be in. Where they just don't. They're just like, oh, we're not going to pay for your medicine now, just because we decided to basically not pay for it, because we have to make more revenue for the shareholders.
Which, as many of you know, like, if that happens and you're trying to get, like, diabetic medications, or, like, what I was fighting with them over was a biologic medication that prevents disease progression. So you can literally die if you don't have your medicine, and those kind of things just happen all the time. They happen all the time, and I've learned one thing after almost dying multiple times because of the healthcare industry and having people I love die, is that you have to have somebody that will fight for you while you're sick. You need a spouse, a parent, somebody to go in there with you to help fight for you, to get the care that you need, to fight with the insurance companies, to be on the phone for hours and hours every day to get the coverage you need.
You have to fight. The system is designed that way, but I almost feel like how what's happening now with these, like, computer programs that essentially, like, an AI wrote that, maybe. Yep. Let's put it that way. AI might have wrote the response. A computer program, though, just, like, made the decision. No human was involved at any level, really.
Right.
So, like, now I don't know, can you fight a computer program's decision, which is just, like, decided? Is there even an appeal process? I think it depends on a private health insurance, their private health company's policy.
Yep.
It's a disaster of a situation. I think everybody,
I know that doctors that I've had get sick of it because they have to resubmit and word it differently and word it just like the insurance company wants it worded, or they can't get the medication or whatever treatment it is for their people, and they get sick of that because they're like, I didn't go to college all this time to write papers for an insurance company. I want to practice medicine. I want to help people.
Yeah.
But they're really impeding their ability to help people. That's what I feel. I mean, it's insane.
I did buy this book. I haven't listened to it yet. There's a book called Medicare for All, Citizen's Guide by Abdul El-Sayed. And he unsuccessfully ran for governor against Gretchen Whitmer a few years ago in Michigan. But his background is healthcare. Basically, like, large scale, like, he's a doc, right? But, like, large scale healthcare things, and he knows a lot about Medicare and a lot about that sort of those systems. Anyway, so he has a podcast out too where he talks. Apparently, he has a lot to say about this healthcare shooting. And I think that it's really, really important that we listen to what he has to say. I think Bernie Sanders has obviously been talking about this forever.
Yep.
Not just Bernie Sanders. The further people like Bernie Sanders, it's just a simple solution, the easiest solution at this point. I know not everybody's going to agree. It's far from perfect. But let's just get Medicare for all. You know what I mean? Let's just get a bottom baseline. And then if you want to get pay for some extra on top of that, great. But at least everybody will have a bottom basement amount, and then like super poor people will obviously, hopefully, still be able to qualify for Medicaid on top of that. So then they would be covered through Medicare and Medicaid in that theory. And that, Medicare, and then we would still be paying some, would be room there for some private. It just wouldn't be everything private like it is now, completely batshit insane. So, anti-dear employment, which is also batshit insane, which is that came out of World War II. It just came out of that time period because they needed to keep people at their jobs. They couldn't, I get it. Like that was the sort of an agreement, but go ahead.
I was just going to say that Medicare for All is a great plan, but the problem with this is the lobbying industry. Okay, so what Medicare does is they will control the prices that they will pay for procedures and medications. And the pharmaceutical companies lobby to get more money. They want more money and they want to charge whatever they want, and Medicare says no. So I think that's one of the reasons the lobbyists do not want anybody to believe that Medicare for All could help everyone. But the real reason, the thing is that it can, because then their prices would be more regulated.
They would have, it would regulate what hospitals and stuff are going to be able to be paid. Yeah, so I really think that obviously Medicare it's not the perfect system in the world, but at least it would be something comparable to like an NHS or different systems that they have, like in different like European countries or England or anywhere in the world. For that
no
matter.
one can believe. No one in the other parts of the world can believe that America, who is rich and all this, lives like this. They think that we're lying when people like get online and talk to each other from across the pond. They're like, oh, blah, blah, blah. I had something happen and I had it taken care of like that. And we're like, holy cow, we have to pay and we have to wait. And
I was watching Robert Reich's YouTube channel, and oh my god, dude, like he was talking about this is like banditry. It's like robbery. Like they're like robber barons, the people that run the healthcare industry. They're just like taking everybody for everything they're worth, and they're just going to take it because they can.
Yep.
As much as they can, as long as they're allowed to get away with it, they're just going to continue to take it.
And he told,
that's just as simple as that. Yeah.
He said some stuff I didn't even know, that I didn't know that some insurance companies were buying out doctors' practices. Or was that United Healthcare that had several divisions?
Yeah.
I did not know that was going on.
United Healthcare actually will buy. They won't pay out enough. Right, or something like that, and cause a doctor to go bankrupt, and then they'll come in and swoop in and then offer to buy their practice from them. And then they'll own the practice, the insurance, they'll own everything from every step down, really. That's actually absolutely
should be illegal.
That's some kind of monopoly.
Yeah.
Apparently that happens on a fairly regular basis now. The private equity industry is heavily involved in all of that as well. We were even talking to your doctor earlier today.
Yes,
and they were telling us all about that. But we don't have to get into that too much. But let's just say, that's, the private equity industry is alive and well in Grand Rapids, Michigan. That's for sure. They're around. So it shouldn't be like that though.
No,
it's just wrong. It's so unethical. It's so wrong. No one gives a shit about anything except the bottom line.
Yep.
And they just got to get that out. Like healthcare should be a human right.
Right.
It should be. They got to get money out of that equation. Like, and it's like preying off of empathy. It's preying off of like the human condition.
Commodifying
it. Yeah, it's preying on it. So it's just sick. It's just sick and wrong. And the people that came up with it, I don't think ever thought it would spiral out of control to this extent. I think they were just trying to find a way to have a system that worked in a pinch. But I mean, I don't think that starting like whatever 1938 or whatever it was that they started doing a system like this. Like they needed to just come up with something. But I mean, this is insanity. It's like hyper capitalism. I'm never going to believe that the American experiment is going to succeed as long as a system like this just is going around. It's randomly devastating you based on your health, randomly destroying people, and on top of that, I think that like I was seeing a lot of people mention this is like we actually have a very low outcome, healthcare outcome.
For the per dollar amount
compared,
spent.
yeah, per the amount of money for the developed world, at least for like we're like dead last.
Yep.
Like, so we have a very, very low life expectancy here compared to like every other developed country. I'm not gonna say we don't have like the lowest in the world or anything, but it's not good. It's been going down. They like we're I swear to God, it's like they're just the ownership class essentially seems like they just want to make everybody peasants, and they don't care about their lifespans. They don't really care about much of anything actually, other than they're just their money.
Just how much they want to keep them alive, as to be able to squeeze as much labor, free labor, and money out of the person.
Keep them working, and then in the second that they're done, they want them done. That's why they're going to go on the attack against Social Security and Medicare.
Get prepared
soon.
to call.
I wish people would actually like be aware of that. Elon Musk has said that multiple times now.
Yeah,
that
they are telling you what they're going to do.
Yeah, going to go after
you just got to listen to them. They are saying they're going to do this. They are not joking. They are planning to do this. You need to call your representatives and stay on the phone and write letters, real letters to them. Write emails.
Well, I mean, like let's not preempt anything. Nothing's happened yet. They're not in power yet.
They're not in power yet.
So I think that like the thing is like they're actually talking about this. Like don't like react and drop out of society just on the rumors of something. You know what I mean? Like it's not time yet for that. You know,
I'm
like,
just saying, stay active, pay attention. They are telling you what they're going to do.
They are telling you what they're going to do. But so people, yes, I think that, and then once they start actually doing that, then we need to take action. You know, there should be massive civil protests at least. And obviously letter rating, I mean, as much as you can, and obviously voting. Because this isn't the last election that just happened. There's going to be other elections, you know. So, anyway, yeah, I think that like a massive expansion of Medicare is greatly needed. And that seems about as far away from reality as you possibly could get right now. However, crazier things have happened. In 4 years, everything could change. So, I mean, hell, in 2 years, everything could change. The climate could be right. You never know. So we should, you got to be ready to, what?
I think that the UN did a big statement about human rights and different things that should be human rights. I think that the United States should codify it in the Constitution.
Yeah, a constitutional amendment.
You have a right to health care.
Yep.
You have a right to air and water and, food. All the basic necessities.
Yeah. Yeah, I think you're right. But I think that, like, in order not to get sidetracked too much, I think, like, I agree with you. Food, water, shelter, housing, things like that are, like, the main things.
Yeah.
But, like we should try to, you're right, there should be a constitutional amendment just guaranteeing a minimum level of health-related coverage for everybody in the United States who's a citizen.
And if you can't do that, you can always lobby your state to do it in your state constitution.
Well, yeah. I think that that'd be the next step. But I am disappointed a little bit with Gretchen Whitmer because I actually did email her quite a while back about this. I said, I think that healthcare outcomes are very bad in this society. I've had a lot of deaths in my family, premature deaths in my family. Sometimes I kind of tend to believe that that could be related to their lack of access to decent quality, affordable health care. Not all the time, but I mean it could be some of the time. And I think that she pretty much sent me a blow off form email that, or her staff did. It wasn't her, I know, but they sent me basically a long email about how the legislative process works, and I should email my legislator. It's just well, I don't think Patrick Ottman really gives a rat's ass about this. I'm sorry. I know that would be in a great, amazing world, I do understand how the legislative process works. That's why I'm emailing you, who I think might actually care about this particular issue. Instead of actually responding, though, to me about that issue whatsoever, she just simply gave me a blow-off, you know what I mean? And, that was disappointing. And I don't feel that is unique to her. I feel like she's great and all that, but I do feel like there's a lot on both sides of the political aisle, with
Yeah.
the exception of like AOC and Bernie Sanders and some of those people. Like on both sides, they both just tend to blow off this issue. Like they're just like, well, then get some better health insurance or whatever. You know what I mean? Like that's like they don't really want to fix it. It's just too expensive, too daunting. They don't see the political will there. I don't know if they see that. I think that like they maybe feel like they'd be sacrificing their own political careers if they ended up doing that, because the healthcare industry like has so many lobbyists and so much power, like that they would just go on the attack. So I don't know. I don't know what the deal is. I don't know. I don't know why that's like somehow. I almost felt like I was touching like a third rail there a little bit. Like she did not want to talk. She did not have even a plan for that. You know what I mean? And all I said in my email was like, hey, maybe Michigan could set up. I know there's no chance at the federal level for this to happen, but maybe Michigan could set up its own universal health care, little, something. I don't know, Medicaid for everybody, or I don't know, whatever would be actually a feasible. It might be an extra tax and it might cost a lot, but at least we'd have some sort of system. But like, I don't think that like that's even something that anybody on any side of the aisle wants to entertain at any kind of state level.
I don't
as
know
far as I
what
can
you're
tell.
thinking now.
So I don't know. I don't think they're thinking anything about it since all this happened. I think that they're desperately trying to hope that it just goes away and will never be an issue again, and no one will bitch about it again. But I think anybody who works in that industry, which is a shit ton of people, is all too familiar with it. Anybody really, it's just everybody. It's not a politically divisive issue either. No. I think that like Luigi is getting a lot of support from both sides, surprisingly. Like I said, he's almost become like a folk hero.
Probably,
and for both sides,
doctors and nurses and
like it's just industry. Not a surprising thing that it happened. Not that people don't have empathy for Mr. Thompson there, but like I don't think anybody is remotely surprised. So in fact, what I said, it's like the amount of restraint from some people is actually even more surprising. Anyway, I really empathize with him. I hope he gets the healthcare he needs in prison. I kind of wonder if any jury in the world is actually going to convict him, but I feel like it's like unlikely that he's going to survive. I feel like the conspiracy theorists. I hate to say it, but I feel like the conspiracy theorists are right. I feel like he's going to end up having an accident or something in prison, which is completely insane.
Yeah.
But it's so kind of what happens. Yeah. But we'll see. Maybe he'll make it. If it makes it to trial, it will be a huge fucking thing. So. Yeah. I don't think anybody's debating the facts of the case. I think everybody, obviously, the question is the morality.
Yep.
So, who's more guilty? When the murderer, like somebody who actually murdered somebody in cold blood, or somebody who had a mass murderer, essentially.
Yep.
That is the mass murderer, the more guilty party. So,
yep.
Anyway, but we'll just have to wait and see what happens with that one.
Yeah.
Anyway, I just could not make a podcast about this, so I just had to talk about it. Had to get it off my chest. I do think it's like probably one of the biggest events of the 21st century in some ways. I know it could have large random like effects further on. We might end up going full on hyper capitalism now. Full on, the response might be just complete insanity, hyper crazy, like private security, private armies for corporations to do whatever the fuck they want.
Yep.
Like maybe the response is going to be way over on the other side. Or maybe I kind of wonder if there's going to be copycats. Are we going to see other CEOs like get murdered? And then like if they do, will that response be completely out of hand? Are they going to like curtail freedom of speech? Are they going to like? Because I feel like there just was a mass shooting in Wisconsin again. But I feel like no one really gives a shit about that. It's sad.
Nope.
Like, no one cares if kids are killed.
Yep.
Like, they're just going to be like, yeah, another mass shooting, another day in America. But, like, this particular, the CEO getting killed, for some reason that created, like,
caused
a
huge
shockwave. Federal manhunt and a whole thing. Like, this like, oh my God, shut down everything. Yep. It created, like, a shot, like, like everything ground to a halt.
Yep.
And our system cannot handle that. Yeah, really, and it's just fascinating. I don't think that anybody's under any illusions. Obviously, since COVID, really, more or less, too.
Mm-hmm.
No one's been under any illusions that we live in like a a system where you got people that are
Mm-hmm.
quote unquote better than other people, and
Yep.
CEOs' lives count for a lot more than kids, apparently.
Mm-hmm.
So, which is pretty sad. Yeah.
That's why a lot of people online were just posting things like thoughts and prayers.
Yeah, thoughts and fucking prayers, right? Yeah,
Thoughts and
no
prayers.
shit. I know. A lot of pent up rage there from everybody, and yours truly too. So,
Yep.
but I don't think it doesn't do any good to dwell on it. I know we're probably never going to do another podcast about it, so I just sort of get all my opinions out about it right now. But yeah. So if you actually are listening to this, I know there's not a lot of listeners, but feel free to comment, feel free to email, feel free to say whatever. Yeah, I really appreciate you taking the time to listen.
Yeah, and we're really interested in feedback too.
Yeah, if you want to give any, yeah.
Yep.
So obviously, and only if it's nice. I appreciate the positive feedback.
Yeah.
I don't know if I appreciate the negative feedback so much, but anyway, yeah, I do like just so everybody realizes too. I've been trying to use a website or an app called Ground News, which is kind of a handy little app that allows you to. Which I'm not getting sponsored by this, but I'm just making people aware that I'm trying to look at the left and right side of the issues. Ground News kind of shows you what percentage of an article comes from the left and what percentage comes from the right, and so you have an idea of what perspective this is kind of coming from. So it's kind of a handy little app. I find it nice. Anyway, I've been using that more and more lately. You do have to pay for it, unfortunately. So that's the shitty thing. But it is very, very cheap, I will say, compared to like a lot. Go ahead.
I was just going to say, how many people, you click on an article like off from Facebook or Instagram or something. You go to the article, and it's behind a stupid paywall. So this, you can pay one price and be able to see the articles.
Unblock those. Yeah, the articles that it's at least linking to apparently are not paywalled. So that's nice.
And again, we're not getting anything paid by these people.
No. But yeah, it is a handy little thing. I think the person I was seeing that was getting sponsored by them was Andrew Callahan and Channel 5 News on YouTube, which is a brilliant YouTube channel.
Yep.
And he covers all kinds of stuff that people should be covering in a way that should be covered. I feel like he's akin to news reporters of another bygone era, actually.
Yep.
He's really and he covers stuff in a very funny way too.
Yep.
He's hilarious, but I mean, he's basically a comedian kind of in a way, but he's not just that. He's really into actually kind of finding the truth. So that's
he also
really cool.
lets people tell their story.
Yeah, he lets people talk.
Yeah. Right.
Yeah, that's a big part of what makes his platform, I feel, very successful. So, yeah. So he was getting sponsored by them, but I actually appreciate that. So, because there are some things I have blind spots, I think, when it comes to immigration. That's not even on my radar in any way, shape, or form, honestly. It's the last thing I care about. I don't care one way or the other, actually, about immigration. It doesn't affect me, in my mind, that much. But obviously, there has been an immigration crisis, in the past few years. And there has been a record number of immigrants coming into the country, quote-unquote, illegally. And there's people paying. And he covered that quite well. And that kind of opened up my eyes to it. I didn't really realize that till I saw that. I'm like, oh, yeah. There really is people flying in from all over the world to Mexico essentially, and then they're crossing the border down there. But and I mean, they're here for a better life, so I'm not diametrically opposed to that. But it still is or has been a crisis in the past few years, and I just like I said, and that's my left leaning tendencies tend to ignore things like that, I think, and I'm not really. That's just an example. Anyway, go ahead.
It has been more on my radar, I think, than you. And I also think that during the time when they were sending parents back and they had kids in the
Oh, I know. I was well aware of it then.
Yeah, that's when it really
But my thought was they should just let those people go.
Right.
Obviously.
That
was...
right. Yeah, no, that's what I'm saying is that's when that really came out for a lot of people that didn't know what was going on until they heard that, and then they were horrified. Because I think that everybody in America that is not native understands that people are going to come here because their relatives came here, their ancestors are from somewhere else. And so it isn't, I think that they need to make a better way or a process of being vetted for citizenship. I think there just needs to be
I think they
a
should
more streamlined thing.
Yeah, I agree with you. That's what I was trying to say.
Faster.
But I agree that there should be systemic change from the top.
Yep.
On that entire system. It needs to be fixed. It is a clusterfuck.
Mm-hmm.
Anyway, I just never really thought about it that much, I guess. I'll put it that way.
I agree, and I think that also we're going to be hearing about this more. I think that all the countries, the bigger, first world countries are going to hear more of it from third world countries moving there because they can't live on their islands anymore because they're underwater.
Yeah.
Or, getting tsunamis every 5 minutes.
People are going to be moving around the globe more and more and more.
Yeah.
Due to climate change.
Yep.
For the rest of our lives.
So we need to figure out some kind of solution for this.
Yeah.
Remember this, Star Trek fans. We're one group of humans on a little blue ball floating in the space. Yeah, we have to get along, people.
There can be optimism here. It's not all dark. I mean, I think we watched a couple weeks ago a video on tragic optimism. And like that's something I think I gotta keep bringing up in this podcast. Mm-hmm. It's like good to be you can be a tragic optimist. Like things can work out. It's just sometimes you got to get through the hard times before you can get to the better times, right? Mm-hmm. So,
yep.
Yeah. All right. With that, thank you very much for listening. We really appreciate it. Anything else that we had to cover today?
I was just going to say that we do have a Substack started, but I have not written on it yet, but I hope to get time to do that. One of us will do that, to try to keep you posted in between podcasts, because as you know, we're not the regularist folks.
No, we're not.
I'm posting, but we have other things in our lives, jobs and things, so this is not our job. This is for fun.
All right, with that,
all right.
want to say,
Bama Pig, Wabaman.
Wabaman, motherfucker.